Well, every parent knows it's so important to store medication up and away from children. Yet, every year, more than 67,000 children are treated in U.S. emergency rooms due to accidental medication poisoning. When you think about it, that's one child every 8 minutes. And making the problem even worse, many medicines look and even taste like candy. Well, today we have a really eye-opening display that illustrates just how tough it is to tell the difference between many over-the-counter medications and candy. Here to talk about it with us from Children's Hospital is ER physician Dr. Katie Stordahl, and I'm going to scoot this gingerbread house a little bit closer to the other one. We have these two, and I don't know if we can get a close-up shot of these, but they look really, really close. Let's explain what we're looking at here.
Right, they do look really close. I had to look at them when I got here to really say, okay, which one is which? Some of the things that are giveaways are a little bit of differences in pills and tablets from the candies. But if you look at these, the colors are similar, the sizes and shapes are similar. These are Sweet Tarts.
On this
These
one.
are Tums.
Wow.
Very similar. And so this is something that you have to think about from a child's perspective, and even for many parents, it would be difficult to tell the difference if these were out on the table.
Bright and shiny, something easy to pick up and unfortunately ingest. And Children's Hospital does this, well covered in plexiglass, as you see there, so kids can't get their hands on these medications. But it's such a good educational tool for parents and caregivers for these kids. Let's talk about what happens if a child does ingest too much of one or more of these over-the-counter medications we all have at home.
And obviously the symptoms are going to depend on what they're taking. But just general symptoms to look for would be vomiting, noticing pill fragments on your child's mouth or on their clothing, especially with toddlers. A lot of times moms will notice that there are little bits of pill in their 2-year-old's child in their mouth, and they'll come in. Other things to look for is if your child suddenly gets very sleepy, if they're not talking or walking or acting right, they're saying their stomach hurts. So very general kind of symptoms that you would really have to be suspicious that your child had taken something that they shouldn't.
True, and we're almost out of time, but you know, parents, we know to keep these medications up. Easier said than done sometimes, especially if you have grandma and grandpa visiting. Maybe they may have medications that they keep out. Let's talk about that real quick.
40% of ingestions that we see are grandparents' medications, and half of those are in kids less than 5 where they don't know to take it, and the grandparents have left pills out on the table or in a pill box. So it's very important if you've got family visiting for the holidays or you're going to visit family to make sure that they keep those pills up.
All right, great advice as always. And let me give you this number really quickly, the Poison Help number, 1-800-222-1222. Always a good idea to keep that handy. Thanks again, Doctor. We appreciate you. And if you have a question about your child's health, just send me an email at ltucker@wate.com. And be sure to tune in every Thursday here on 6 News at 5:30 to see if we use your question on the air.